Welcome everybody for the new episode of the Ocular Insider, our podcast about the dry eye and ocular health issues and also dry eye clinics. I have this privilege today in Copenhagen, in a nice view of the harbor. Have a special guest today with me, and it's Othman from Saudi Arabia. He's assistant professor on IAU University Hospital in Dammam, Saudi Arabia. He's a corneal cataract specialist, refractive surgeon, and also dry eye specialist, treating already a couple of years with our beautiful technology, and also having a lot of patients and a lot of experiences to share with us today. On my right side is sitting our friend, also the user of our technology, and also entrepreneur of the new approaches in the dry eye treatment, and also the educational system and platform for educating the new doctors of Othman University, dry eye spa clinics building around Latino America. Andrés Benatti from Cordoba, Argentina. So welcome, guys.
Thank you very much for having me.
So I'm very happy to have you today because we will have a very nice topics, and I knew that you have a lot of experiences already running successful dry eye clinics in your countries, Middle East, Saudi Arabia, and Argentina, Latin America, with a very different, landscapes. Maybe the weathers are not that much different as we may talk, but I believe that the patients' expectation, education is in similar way. So my first question to both of you, how do you think is the best setup of the successful dry eye clinic? So what do you think, Ahmed?
Yeah, thank you for having us. This is such a great opportunity to meet with you and to discuss these things. To be honest, in Saudi Arabia, the dry eye privilege is exceeding the global numbers. When you see the literature, you can see that globally it is ranging between 20 to 40% of population. In Saudi, we are reaching up to 60%, and it is acceptable and understandable when you see the weather, the hot, the sands, the things are making the dry eye is even more challenging to us. And those patients are really suffering, and their lives has been affected. The quality of life is being affected. So you have to be really prepared for such a problem. So understanding the magnitude of the problem is important, and to have good preparation is even more important. So having a proper clinic, having the most of the machines and most of the technologies that are helping you to diagnose and treat the dry eye is essential. For us, maybe all clinics, they are, have to have, the doctor who is having the experience how to ask the certain good questions. So history is really important, and examination in slit lamp is really important to see the signs of a dry eye, and also to have the technologies to shed the light in the areas of the dry eye, like what we are having, the tear check machine, which is an amazing tool that will give you an insight about this patient situation and where is he exactly. Is he in the mild, the moderate, the severe? You would have the exact numbers. It is a test which is easy, simple, fast, and will put the patient also to knowledge. Once the patient seeing those results, once the patient see that he is having this problem, when he sees the myopography by himself, once he is aware, he will take care more about himself, and he will be more compliant to treatment. So having good tools in the diagnosis, and having also good tools in the management. And as I'm always saying, that globally, universally, the dry eye treatment is just drops, just a lubricant, just a refresher drops, with companies fighting which is better, and we are better. However, we know that the dry eye is causing inflammation. The inflammation will cause a dry eye. The dry eye will cause inflammation. So it is a vicious cycle. So only lubricant will not solve the issue. You have to break the inflammatory parts, and it depends on the situation. We can use sometimes steroid, which has its own side effect. Steroid sparing agent, which needs a long time and good compliance. And now we are having technologies such as the IRPL, which is very safe and effective, and changed already the patient's life to the better. So having good tools to evaluate and having good tools to treat is the way to establish good dry eye clinic.
Thank you for very nice comment. I already see that the focus of of having the plan, what to do with the patient. This is the key for a first start. So how do you feel, you, Andres? Because I know you were having a lot of lectures about setting the chains of the cooperation between the different doctors. How do you feel that the dry eye setup of the new clinic should look like?
Well, of course, I agree with Ahmed. Tools and technology are very important, but I also, as we were discussing in the lecture, there are three key points that are very important also. Patient experience. We need to offer a great patient experience. These patients are tired, are frustrated, and they want to live another kind of experience. So from the moment that they cross the door, we have to offer a differential, a value proposition from the experience. We need to offer the best results possible with technology, IRPL, good diagnosis. We have to be close to our patients. They have to feel that the doctor is close to them. And of course, we need to, and for me, maybe this is the most important tip, education. We need to educate our patients and also our staff, because we have to change the mindset. We were discussing today all together about how changing the patient, the typical patient of dry eye. Maybe a few years ago, we had the typical patient was an old woman with rheumatic disease, and now we're seeing young people, workers, hard workers, computer workers, gamers, children. So we have to change that mindset, and we have to educate the patients about this pathology, about what is a chronic disease, that there is not a solution right now forever. This is a chronic disease, and also educate about all the possibilities that, as Ahmed said, we have even more than the drops, the typical drops. So for me, those are the key for a successful dry eye. Patient dry eye center, patient experience, results, and education.
Education.
Yep. Andres, that's really good insights, and I really like that when you said loyalty of the patients. When you building the bridge between the knowledge informing and behind scenes, and the patient then understand, so the patient can follow your advices and also the protocols that you suggested. I know, Ahmed, that you're doing even something behind that. Your success story is also on personal experiences. So what do you think works with I know it's not like manipulate with the patient, but giving them trust that you fully believe in what you're doing. So what is the best of?
Yeah, for sure. So the IRPL, I have tried it first on myself. Okay, I've done sessions to myself. So, and when patients knows that I have done it to myself, they will gain the trust that this is really safe technology. Our doctor, he's doing it to himself, which means this is really important. And why I did it to myself? Because I've seen my colleagues that I have done to them, my family members. My sister, I did for her femtolasic, and she's starting to have the dry eye. Then I did for her the sessions. Now it is 3 years. She is 0 drops. She is not using any refresher drops after the femtolasic, which has a cut. It's not a surface treatment, a PRK. A femto has higher rate of dry eye. And since and even though it is a femtolasic, she has no dry eye. So my family member, I have aunties, my mom, my uncle, he is a professor, he's an orthopedic spine surgeon. I have done it. Almost any member of my family, I have done for them the RPL, and they are really happy about the results. So it is really safe, effective, and helping. So if you have some good technology, you want to offer it to everyone, starting with those beloved to you and close to you, because it is really good technology.
Yeah, I see this also the same way. If you fully believe and you see there is no side effect, actually, okay? So this is the technology that I always telling our new customers, why not to try on you?
Absolutely.
Can you imagine that you just want to try the intraocular lens implantation just because you want to be sure that it works for your customers? I believe so. It's not the good way. And also always asking when I see the high refractive surgeons with the high presbyopia and still wearing the glasses.
That's true.
And that's exactly like you said. The self-experience can give confidence.
Of course.
Mm-hmm.
So is it different in Argentina? Would you think the Argentinian patients would react differently?
I think the patient is pretty similar, right? Because these are patients that are suffering. And as I said before, they are kind of tired of being by ophthalmology and just using maybe 5 or 6 drops 10 times per day.
Mm-hmm.
So the frustration of our patients, I would say, could be the same, even when they have more prevalence of dry eye because weather and the geography of the country. But the frustration is the same in Argentina, in Arabia, in US, in Europe. We have to deal with that, right? Because these patients with a chronic disease are having so bad times, right? Having bad feelings about the disease. So they are looking for a solution, and they have to understand that there is not a magical solution, but we are here with technology to support them and to give them and offer them the best possible solution, right? And
Exactly.
as I told you before about education, they have to understand that there is no treatment, that they just get a treatment, then get out and they didn't come back anymore, right?
Mm-hmm.
We have to try to work on prevention to our patients, educations, and that is the successful treatment.
If you allow me to add something, you mentioned something which is very important, education. Education is for patients and for doctors and to yourself. You have to keep yourself always updated. Okay, so when you meet with experts like Peters and others, when you go more deep in this technology, you found that this technology is not only treating dry eye. When you understand that it is, controlling the inflammatory mediators coming to the eye, and it is decreasing this inflammation, you found that you are treating patients with like atopic dermatitis, someone who is with a raccoon eye, with a coarse, dark skin, itching, very bothered. Okay, once I give those patients these sessions of a treatment, first of all, the dry eye is going away slowly, okay, with continuous sessions. The dark pigmented areas becoming lighter, so the halos around the eyes, their shape, they are becoming even more attractive. Their wives are coming, thankful, what you have done to my husband. The redness in the eyes getting less, the itching, the discomfort. You are changing 180 degree of their lives. I have cases with ocular cicatricial pemphigoid, which is a conjunctival disease that is a chronic, slowly increasing. The fornix, which is the distance in the conjunctiva, is slowly closing. Those patients, they are reaching into a point that they cannot even blink. They will be blind by the end of their life. I have managed to treat now, I'm preparing this paper for publication for 5 cases who I have treated with IRPL, and they have just not only stopped the progression of this disease, also the fornices are getting deeper and deeper, and the patient are really thankful for what you have done. They are having some kind of VKC, vernal keratoconjunctivitis. It is an allergic, condition, okay, which has been treated successfully and reducing the amount of episodes of allergic attacks that they are having. It is all due to understanding of the core way of this technology, as it reduces the unwanted inflammatory mediators coming to the eye, and thus controlling the and restoring the normal tear film composition. So educate yourself, read more to be more confident, educate your colleagues, and of course the community. We have to educate our community through the channels that we are having in the social media. Now we are on YouTube, in TikTok, in other platforms. You have to educate people that don't lose hope. The technology is always evolving. Don't lose hope. We are always having a new technology and solutions for you.
Yeah, it's definitely true that I think the ophthalmology is one of the medical part in the world that's developing last couple of years, really like rocket booming. It's a fast running run with a lot of new things coming in, coming out, new wave of finding. And I think that this is the best way how to help our patients. And also this is our mission, how to improve the human people's lives. I knew that you mentioned very interesting topic, and it's the question probably again for long run, how to improve prophylaxis in ophthalmology, and especially in a dry eye, because we now see the young generation now, and we already knew that this will be our future patients, without having zero access, only when they are moderate severe. What do you think that should be a key for those future development? How to let's say move the ophthalmology on next level, to give the ophthalmology chance to grow, to be not just catching my worst patients, but try to prevent. So,
if you may allow me, before talking about the future, let's get just 100 years in the past. Before 100 years, our life is totally different. Our jobs are totally different. We live in farming, those opened areas, okay, in the market, selling in opened areas. Now we are living in very small, apartments, small homes, okay. Even our, most of the humanity are working in a cubics in front of computers, intermediate distance. And even when they want to get entertained, they will get their phone for TikTok and these social media things. So even for entertainment, we are getting closer and closer and closer. And this will put a strain on our eyes. And the last study that they have read that they are saying that humanity by 2050, 50% of population, they will have myopia, nearsightedness, because of this, global problem, a global change in how do we live, how it's changed from the past into the present, and we don't know what is going to happen in the future. So we have to, as you mentioned, a step now, try to find solutions, try to stop this from progressing, from destroying the coming generations, how to prevent this problem. And we are always saying by good education, you have to make people aware about the magnitude of the problem, try to give them simple good solutions like the 20-20-20 rule, which means that every 20 minutes of working, you have to rest for 20 seconds by looking at something which is 20 feet or behind, to rest your eyes. Try to have always periodic testing of your vision, of your eye. You have to go to the doctors. You have to, you have to take good care of your eyes by periodic examination and seek help if you need. So this is, I think, very important, is the awareness and the screening that you have to do for those people.
Agree. Awareness, it's the key, right? And you're doing a great job on social media, and this is important because we have to become an educator in dry eye, right? For, as we were talking, our patients, our staff, our colleagues. But prevention is also another important question, key here, right? Important point in dry eye disease. Today in the lecture, I said that we have to be like a dentist, right? You don't go to the dentist when you have a problem in your teeth. You go for prevention. You go twice per year to check your mouth and see everything's okay. Well, dry eye specialists should be the same for all patients. You don't have to wait that you have a severe dry eye and your ocular surface is destroyed. You have to try to go before that and keep your ocular surface in a healthy way. That is the mindset we have to teach to our patients.
What is the standards right now? So I know that we have a check once you are very small, 3 age old. Then you have another check when you are preschool. Then maybe you have a check if you want to have a driver license, correct? Yeah. And then once you have a problem. Yeah. And I think this is exactly the point where the society actually lost the track. If you do not have a myopic patients, which will stay with you, the rest of the normal vision, it may have a problem with the dry eye. It will come only when they really have a serious issue. So is there any way how to change this?
Yeah, if you, I have patients who are having chronic dry eye, chronic MGD, meibomian gland dysfunction, that they have never been screened before, as you have mentioned, lost track. And over the years, what is going to happen if you don't diagnose early? Those patients with the chronic meibomian gland dysfunction, they will have many, let me say, irreversible changes. The lashes will fall down. We call it madarosis. The lashes will twist to rub against the cornea. We call it trichosis.
Okay.
And the lashes, they will become white. We call it poliosis. And I'm seeing those changes in the lids of those patients who are having a chronic MGD, which has not been diagnosed, not been treated. So he is coming with you in a lash, which is rubbing in the cornea, causing corneal erosion, then corneal infection, then corneal scar, then a blindness.
Yeah.
You get my point? It is a chain, a cascade of reaction.
Yes.
If you don't reach it in the early stages, you are threatening this sight to be lost. This patient vision will be lost if you don't catch it early. So what you are talking about is really important, to catch the problem very early, to treat it as early as possible, to prevent all these things. You can really save patient eyes.
But imagine this: we have patients with keratoconus without a topography in the interfaces. Yeah, so they come to our consultation for the very first time, maybe a 35 years old patient with keratoconus without any topography. Can you imagine that this patient we're gonna get a dry eye check? No, it's hard to accept, but it's true. I mean, there are so many patients that they live not in big cities, they live in periphery or in little towns, and they don't have the possibility to get a dry eye check. With technology, with specialists, I think that is the challenge in the future, right? Because the lifestyle is changing, as Ahmed said. We are all day with computer, video games, screens. So we have to change our mindset.
You ask about solution or possible suggestions how can we solve such an issue? Any new employer that transferring from one company to another company, he has to have a check of the whole body.
Yeah.
Maybe there is something which is a standard check, which is easy and fast. You will go to these centers that they will check the blood, the things, and there is an eye doctor who has to check. So this is one solution. The other solution, when you renewing your driving license, I didn't know how frequent in your country, but for us, every 10 years.
Yeah, it's the same.
Every 10 years that you have to renew. And every 10 years, at least, you must pass the vision test. And better to have a clinic, an ophthalmology clinic nearby or in the same governmental center or they have to find a way that you have to check every citizen every 10 years at least.
Yeah, but these tests are very simple. They put you on a reading test. They basically just measure your reading ability if you are far or myopic. That's the simple way. They do not go deeply. I may agree also with you that the idea, because employment check is very regular. I never went to the ophthalmologist. Yeah, they send me to the urologist. I don't know. Urologist is the reason, or they check my chest if I can breathe through the very low salary. No, this is the point. You go. We've been discussing. Like huge companies investing a lot of money for treating the sick employees. And now we have a huge companies, and this industry is booming, definitely working in 12 hours on computers. And with the computer visual syndrome, as Andrés is very nicely commenting, that these could be the one of the first in line who should be really in standing to having their employees in full shape, not having the productivity lost. I know that in Saudi, due to the environment, living in air conditioning rooms and everything, I'm sure that it's one of the key problems.
Correct. True. I agree with you totally in this manner. And also, you can do some, campaigns we are doing in malls, in streets, every now and then, like a a sight day. Okay, we can create a dry eye day at least once per year, that we shed the light on dry eye, the symptoms, the signs, and we can also examine people in streets or malls. We do have like keratoconus day. We do have glaucoma day.
Yeah.
We do have, but we don't have, I think it is reasonable to have a dry eye day because it is
or full months.
Yeah.
powerful.
The dry eye
Yeah.
awareness month. Yeah.
Awareness, yeah.
Because that's, I think one day is not enough.
One day is not enough, correct.
One thing that we need to understand that the lifestyle that we are living right now, it doesn't change. It won't change in the future. So we have to change our way to communicate dry eye and the possibilities that we have to fight against dry eye, right? Because people will be on the phone, we still be on the computers, screens, and it's fine. It's the kind of lifestyle that we are living right now at this moment. So we have to work in other way. So
I have an idea, which is maybe just, and I like to think loudly. You see, when you have your
Out of the box.
out of the box, okay? When you have like a smartwatch, a Samsung or an Apple Watch, it is, testing your heart rate, it is testing these parameters
Yeah.
that will keep you, and it will tell you are not moving enough, go and move. You are not breathing enough, you are not resting enough, you have to stand, you have something. I believe the technologies, they can monitor the eyes. Okay, when you see this technology that is, the Face ID, it is testing like 30,000 points in your face. They know that you are closing your eye, it will not open. They know how frequent you are blinking. I think this technology can count how many times that you are blinking. And if your blinking is complete, maybe some technology, if they shed the lights on that, it will tell you, you are suffering from dry eye symptoms. You are not blinking enough. You are having rest, close your phones.
Even that's what my phone is actually now telling me. Switch off the screen
Oh,
to save the battery. Yeah, it's really in Samsung a new IP.
there is technology in the cars that they tell you,
You need to take a coffee.
yeah, exactly.
Make
You freebie.
take a coffee. Make a coffee dedicated.
Pull over and
make it's tracking the eye, by the way.
This is
I think the Nescafe pay for this gadget.
Yeah.
No, thank you so much. This is, I think, the great closing of our discussion today. So definitely awareness. We need to increase the awareness of the problem. Try with this month, day, whatever, minute, second. It's a really great insight of, maybe the really computer telephone companies can be the game changer in that, because they can implement easily in the new software of the artificial intelligence, these kind of gadgets that can help us to identify first sign of the problems and tell the users of the telephone, or maybe small things, implement the parents lock once the kid is playing more than 1 hour the telephone, switch off the screen for a couple minutes, just to start blinking, to disturb the kid. Something is happening, is not logical. And that could be the way, I believe so.
Yeah.
So thank you so much. Thank you for a great insight, Ahmed Othman and Andrés Benatti. So hope you enjoy this very nice episode, and I hope that you will enjoy watching on YouTube and listening on Spotify.
They are listening, they have to subscribe to the channel.
Definitely.
follow us.
I will not be happy unless I see 10,000 likes on this. So please like and subscribe.
Oh, thank you. So give us a thumbs up. Thank you so much.
Thank you.
Thank you.